parts of the body, including the palms of the hands and soles of the feet. The rash evolves into fluid-filled pustules, covering the body. These pustules can be extremely painful and may leave scars once they heal. Transmission occurs through close contact with infected animals or humans. This includes direct contact with the rash, bodily fluids, or respiratory droplets of an infected person. Bodily fluids, respiratory droplets, and contaminated materials can all harbor the virus. It's important to practice good hygiene and avoid close contact with those who are infected to prevent the spread. While often self-limiting, Mpox can be severe, particularly in young children and individuals with weakened immune systems. These groups are at higher risk for complications, which can include secondary infections, pneumonia, and in rare cases, death. Therefore, timely medical intervention and supportive care are crucial for managing the disease and preventing its spread. Mpox is not a new threat. For decades, it has plagued parts of Central and West Africa. Since its identification in 1970, the virus has found a foothold in these regions, becoming endemic. Limited resources, inadequate healthcare infrastructure, and a lack of global attention have allowed Mpox to persist. Communities have borne the brunt of this neglect, enduring recurrent outbreaks with minimal support. The current Mpox outbreak in Africa is unprecedented in its scale and severity. The Democratic Republic of Congo in particular is grappling with a catastrophic situation. Cases and deaths have reached alarming levels. A new, potentially more transmissible variant is adding fuel to the fire. This variant, characterized by atypical symptoms, is further complicating detection and control efforts. The virus is spreading beyond the DRC's borders, reaching neighboring countries. The situation demands immediate and comprehensive action to avert a regional health disaster. Section 5. A global clarion call. Who declares a health emergency? Recognizing the gravity of the situation, the World Health Organization, or WHO, has declared the Mpox outbreak a public health emergency of international concern, known as FEIC. This declaration is the highest level of global alarm, signaling the need for a coordinated international response.
The FEIC serves as a wake-up call to the world. It emphasizes the potential for Mpox to spread beyond Africa and the need for collective action to contain it.
Section 6. Shifting sands. Understanding the unique nature of this outbreak. In this section, we delve into the complexities and unique characteristics of the current Mpox outbreak, which has taken the world by surprise. The current Mpox outbreak is distinct from previous ones in several ways. Unlike earlier outbreaks that were largely contained within rural areas, this outbreak has shown a remarkable shift in its transmission patterns. Historically, Mpox outbreaks primarily affected individuals in rural areas with direct exposure to infected animals. These outbreaks were often linked to close contact with wildlife, particularly in regions where people live in close proximity to animals. However, the virus is now spreading in urban centers, a phenomenon that has not been observed in previous outbreaks. This urban spread is facilitated by the high population density and increased human interactions in cities.
This shift in transmission dynamics raises concerns about increased person-to-person spread. In densely populated urban areas, the virus can spread more rapidly, making it harder to control and contain. Furthermore, the demographics of those affected have changed. In previous outbreaks, the majority of cases were among adults who had direct contact with infected animals. Now, children constitute a significant proportion of cases. This is particularly concerning because children are more vulnerable to severe outcomes from the infection. This alarming trend underscores the need for tailored interventions to protect vulnerable populations. Public health strategies must now focus on urban settings and include measures to safeguard children who are at higher risk. Effective communication and education campaigns are crucial in these urban areas to raise awareness about the virus and promote preventive measures. Community engagement and cooperation are key to controlling the spread. Researchers and healthcare professionals are working tirelessly to understand the evolving nature of this outbreak. Their efforts are aimed at developing targeted interventions and treatments to curb the spread and mitigate the impact on affected populations. The global health community must come together to address this unprecedented challenge. International collaboration and resource sharing are essential to effectively combat the spread of Mpox and protect vulnerable communities worldwide.
Section 7. A race against time strategies for containment. Containing the Mpox outbreak requires a multifaceted and aggressive approach. Early detection and isolation of cases are paramount.
Contact tracing is essential to identify and monitor individuals who may have been exposed to the virus. Public health messaging plays a crucial role in raising awareness about Mpox, its symptoms, and ways to prevent transmission.
Section 8. The Vaccine Imperative, a cornerstone of Mpox control. Vaccination is a crucial weapon in the fight against Mpox. While a smallpox vaccine has shown efficacy against Mpox, global supplies are limited. Prioritizing vaccination for high-risk populations such as healthcare workers and close contacts of cases is essential. Efforts to develop and manufacture new Mpox vaccines are underway, but require time and significant investment. Section 9. Beyond vaccines, a multifaceted approach to containment. While vaccines are a cornerstone of Mpox control, other interventions are equally important.
Antiviral drugs, though in limited supply, can be used to treat severe cases. Improving access to these treatments, particularly in affected countries, is crucial. Strengthening healthcare systems in endemic areas is paramount. This includes enhancing surveillance, laboratory capacity, and infection prevention and control measures.
Section 10. A call for solidarity, funding the fight against Mpox. The global response to the Mpox outbreak has been sluggish and inadequate. Funding remains a significant barrier to effective control efforts.
The WHO has issued an urgent appeal for financial assistance to support affected countries. However, commitments have fallen short of the need. Increased and sustained funding is essential to provide vaccines, treatments, and other resources to those on the front lines of this outbreak.
Section 11. United We Stand, global cooperation for an Mpox-free world. The Mpox outbreak is a stark reminder of our interconnectedness and the shared vulnerability to infectious diseases. In an era where the world is more connected than ever before, the spread of infectious diseases knows no borders. The Mpox outbreak has shown us that a health crisis in one part of the world can quickly become a global issue, affecting millions of lives and disrupting economies. No country is immune to the threat posed by emerging and re-emerging pathogens. The rapid spread of Mpox has highlighted the need for a robust and coordinated global response. It is not just about protecting individual nations, but about safeguarding the health of the global community. The interconnected nature of our world means that an outbreak in one region can have far-reaching consequences, impacting travel, trade, and the overall well-being of people everywhere. Global cooperation is not a choice but an imperative. In the face of such a formidable threat, countries must come together, setting aside differences and working towards a common goal. This cooperation involves sharing vital information, resources, and expertise to combat the spread of the disease. It means supporting each other in times of need and ensuring that no country is left to face the crisis alone. The strength of our response lies in our unity and our ability to act as one global community.
We must work together to strengthen surveillance systems, share information, and develop and deploy medical countermeasures. This includes investing in research and development to create effective vaccines and treatments, as well as ensuring that these medical countermeasures are accessible to all, regardless of geographic location or economic status. By pooling our resources and knowledge, we can accelerate the development of solutions and ensure a more effective response to the outbreak.
Only through a united and coordinated global response can we hope to control this outbreak and prevent future ones. This means not only addressing the current crisis, but also building stronger health systems that can withstand future threats. It involves creating frameworks for international collaboration and ensuring that all countries have the capacity to detect, respond to, and contain outbreaks. By working together, we can create a safer and more resilient world.
The time for action is now. The world is watching. Our response to this crisis will set a precedent for how we handle future health emergencies. It is a test of our ability to come together and act decisively in the face of a common threat. The decisions we make today will have lasting impacts on the health and well-being of future generations. We must seize this moment to demonstrate our commitment to global health and solidarity.
Let history judge us not by our words, but by our actions. Our legacy will be defined by how we respond to this crisis. Will we rise to the challenge and work together to overcome it, or will we allow division and inaction to prevail? The choice is ours, and the stakes could not be higher. We have the opportunity to show the world what is possible when we unite for a common cause.
Let us rise to the challenge and work together to build a healthier and safer world for all. This is our moment to make a difference, to show that we are capable of overcoming even the most daunting challenges through cooperation and solidarity. By working together, we can create a future where outbreaks like Mpox are a thing of the past, and where every person, no matter where they live, can enjoy the highest attainable standard of health. Let us commit to this vision and take the necessary steps to make it